little distracted at the beginning, just admitting all of these people who are joining a few minutes late, but it's nice to virtually meet you all. My name is Dr. Kane. I'm going to be talking tonight about how to stand out as a pre-med in 2026. It's such a competitive space, and so I think any way we can kind of help you guys work on building a standout application is the goal tonight. All right, so I'm just going to start by talking a little bit. Well, we'll go over an agenda and then I'll talk a little bit about myself. We'll talk about the timeline to medical school, what makes applicants stand out, building a strong foundation in high school, since I know a lot of students are high schoolers. We also have some college students and non-traditional students here, though, so I'll comment on that as well. We'll talk about courses, extracurriculars, and volunteering. And then we'll also talk about excelling in college, like choosing a major, extracurriculars in college, and then unique opportunities to stand out. And I'll actually be talking about one cool opportunity you could start as soon as today or this summer if you're interested. And then we'll do a live Q&A session. So make sure you stick around until the end if you have any questions that you're hoping to get addressed. At the top of this chat, it might have got lost with everyone sharing, is a link to ask questions. We'll do it through a Google form. So if you have questions throughout the webinar, you can enter them into that form. I'll resend it midway through just so it's fresher in the chat. But if you think of any questions, you can put them in. All right. So a little bit about me. Like I said, my name's Dr. Kane. I did my undergrad studies at Lafayette College. I majored in neuroscience there and I minored in creative writing, which has just always been a passion of mine. I grew up in Connecticut. I went to medical school at UConn, which was fitting for me and convenient with in-state tuition, but go Huskies. And then currently I am an internal medicine resident at Beth Israel in Boston. It's one of the Harvard Medical School teaching hospitals here. And I'm in my final year of residency. My final year starts in July, actually, a little premature. So I have about a year left. And then I have the honor of being able to serve as chief resident in 2027. So I'm very excited about that. That'll tack on an extra year of my residency to make it a total of 4 years. It's usually 3. And then I'm also the founder of Docera, which is a pre-med education company. And I'll talk to you about that towards the end, just briefly. And I also wanted to kind of share what I love about medicine in this section, since I think a lot of students here are really excited about the thought of becoming a physician. And I would say that what I love most about being a doctor is kind of having a window into patients' lives. I think a lot of people think about being a doctor as great because you get to help people and you get to save lives. But I think what I enjoy most about it is learning patients' stories. And oftentimes, the first time I meet these patients, they kind of immediately let me in on some of their deepest fears or darkest struggles or their goals in life. And it's just a very special bond that you get to have as a doctor with patients. You just immediately are let into their life. And I just think it's such a privilege. And so it's one of the most fulfilling parts about this job for me. I also, on a lighter note, enjoy learning. I've always loved studying and learning, which many doctors will tell you, since medicine is a career of lifelong learning. You really have to love the practice and you have to love kind of sitting at night and reading about medicine. Since that's what we do, there's never a day that I don't learn something new. All right, now let's transition into helping you all. Enough about me. We'll talk about the road to medical school and the timeline of what it looks like. So this is just a generic slide, and then we'll get into some more helpful advice. But in high school, I generally like to think that students should be focused on building strong academics, especially in science and math, exploring healthcare through volunteering, shadowing, or extracurricular programs, perhaps developing some leadership and communication skills, and also just reflecting on your why for pursuing medicine. In the college years, you'll often have spend a lot of your time completing prerequisite classes, which are just required for students who want to go into medicine, like biology, chemistry, orgo, physics. One thing about these classes is they're pretty difficult and they don't actually teach you medicine. They teach you topics that you need to know to be able to understand medicine. But unfortunately, they don't teach you what it's like to actually be a doctor. And so I think that's kind of a gap in the pre-med space, which I'll talk about in a little bit. But also, in college, I think one of the focuses should be maintaining a strong GPA if possible, building relationships, especially early. If you have the luxury of being here as a high school student today, think about as you go into college, like finding faculty mentors early in your college career to try to develop as long of a relationship as you can so that they can write you a letter of recommendation that's really strong. Also, getting involved in clinical research and service experiences. In college, you'll have the lovely experience of taking the MCAT, which is the medical school admissions test. And then you can apply through AMCAS, which is the medical admissions platform in May or June before senior year. And then application year kind of looks like applying in May or June, attending interviews August to February, and then receiving acceptances on a rolling basis in October through March. And then you'll matriculate the following summer. That's just a timeline. So why are we talking about this now? Why are we having this webinar? I think careers in medicine are extremely competitive and only getting more competitive. I was actually sitting at a meeting with some of the faculty at the hospital I work at. One of them was a dean at Harvard and was saying that it's just ridiculous now how much students need on their resume to get into medical school. Like some people literally have the resume of like a PhD person who has completed a PhD and are still not getting into medical school. It's just really tough. For some data in 2024 to 2025, there was about 52,000 applicants to US MD granting medical schools. So this doesn't include overseas or DO schools. And only 23,000 got in. So that's about a 45% acceptance rate. And many individual schools actually have much lower rates of acceptance. Stanford has about a 1.4 acceptance rate, and many other medical schools are like less than 3%. So it's really competitive, and students who start early tend to build the strongest applications. So I kind of have a unique framework for what I tell my students as to how they should try to get into medical school and the route that I did and that some of my friends did. I think this slide is what most people will tell you when you go for other webinars, or maybe you go to a high school counselor or the internet or ChatGPT. I think you'll get kind of a checklist approach is what I call it, where you should maintain a high GPA, you should get into a top college, you have to score well on the MCAT, you must have hundreds of hours of shadowing and volunteer and do research and get published and join leadership roles and write a good personal statement. It's really overwhelming. And while this does have merit to it, a lot of this is true. These are experiences you probably need. I would say many people who follow this approach don't get in. So it's time to take a new approach, and that's what I'd like to propose to you all today. So I think the way that I like to think about how you should structure your med school application is to try to reflect on what your passion is, to find your passion if you don't already know, and try to carry it through your pre-med journey so that you can tell a story that is reflective of who you are and what you contribute to the community of medicine. So choose a passion that really excites you. Medicine values curiosity and drive and sustained commitment to something. And so if you have a passion already, and even if it's not medically related, which I think would be the case for the majority of you being so early on in your careers, for example, if you enjoy playing the violin, and maybe you're very good at playing the violin, you can carry this through your application by being creative. For example, reach out to a hospital, ask to become a volunteer to play violin for patients. One of my co-residents at Beth Israel does this, and it really stood out to the admissions committee there when he applied that he does this. And so you have to be creative and don't be afraid to get shut down. The worst someone can tell you is no. So you need to show consistency and growth over time. And I'd like to give another more in-depth example to try to help you grasp what I'm trying to advise here of finding your passion. One of my good friends who is a surgery resident at Mass General Hospital in Boston currently kind of shared his application with me, and because he followed this approach as well. And we were reflecting about it recently. And he shared that when he was in high school, he realized that he loved learning about how things work and how to build things. That was his passion. His passion was engineering. And so his goal going through high school, college, and into medical school was to weave his personal interest into a cohesive pre-med narrative, like we were just saying. So in high school, for example, he joined the robotics team and he presented at a robotics conference and competed nationally in robotics. And then in college, he majored in biomedical engineering while taking pre-med classes on the side. And he joined a lab that was to help develop medical devices to improve accessibility for patients with disabilities. All right. And then let's see here. So if you decide to become a surgeon, like this individual, he decided to become a surgeon because he was able to then reflect in his personal statement too, like, I want to be a surgeon because it's similar to my passion, which is to build things with my hands. And then he was able to kind of weave all of these experiences he has had between like surgery and engineering and his passion in order to tell this cohesive story about why he thinks medicine will allow him to do what he loves while helping people. Okay. And so over time, especially if you kind of find your passion and you carry it through, ideally the goal is that your story becomes one of someone's who's always been driven to solve problems that improves people's lives. And that thread, that consistency, curiosity, purpose, it really stands out much more than someone who's just checked all of the boxes on the previous slide that I shared. Sometimes the checklist approach, it's fragmented. None of the activities relate to each other, and you can't tell a cohesive story about who you are and why you will make an excellent physician. So medicine's really not one path. It's not a checklist approach. It is how you bring your passion and your identity, your personality into the service of others that will define your story into medical school and beyond. So let's talk about practically how you can use this in different avenues. So building a strong foundation, we'll find our passion and we'll carry it through our pre-med journey. Let's talk about coursework first. So I would advise if you're in high school or even in college, I would advise you to take rigorous science classes. It's always better to try to challenge yourself, and schools can recognize that you're doing so. Pursue courses or programs that align with your passion, even if this is outside of school. We live in a day and age now where you can find any opportunities online. You don't need to be restricted to your institution and what they are offering you. So for example, if you were like my friend who enjoys engineering and there's no engineering class in your high school, you could find one online, for example, and do that in your free time to show your dedication to this, or maybe a robotics class or something else. So another thing that I like to tell students is to maybe take coursework in communication skills if that's something that you struggle with or something you want to work on. Another kind of overlooked skill that medical school admissions committees are looking for is excellent writing skills, excellent communication, and presentation skills. As a physician, I spend most of my day communicating with my patients. I have to explain really complicated medical topics that took me years to learn in simple language. We usually say at like grade 7 level. Even when I'm talking to an adult, we're really simplifying really complex, dense information and having to communicate it clearly so that someone who doesn't understand medicine can know what's going on with their health. And so having communication skills, writing skills, presenting skills is extremely important. You should also seek out presentation opportunities. That kind of bounces off this. Presenting is a skill, and doing it more and more will help you get better at it. Also, you can include presentations on your application. And then consider courses that expose you to clinical science. I think one of the issues I brought up earlier in the webinar is that a lot of students that are taking all the pre-med classes, they're not actually learning medicine. You're learning organic chemistry, physics, sure, but that doesn't relate or help you take care of a patient. And so I really don't think that there are opportunities to learn medicine now for pre-meds, and that's part of the reason I created Docera and one of the cool opportunities I'll talk about with you in a bit. For extracurriculars, I recommend pursuing extracurriculars, going to sound repetitive, in alignment with your passion to show consistency and drive. I really think it's more worth it to pursue one thing very deeply than to pursue a scattering of extracurriculars that don't tell a story or really like make sense together. So consider also doing experiences that expose you to the realities of healthcare, like shadowing, volunteering, EMT certifications. Some people become medical assistants, things like that, to get to know, like, what is it like to have a patient in front of me? And do I enjoy it? And then try to get leadership roles. So I think having a leadership role is much more powerful and important than having a large quantity of clubs that you are a member in. I remember being a pre-med student and entering college and going to the fair when you first start and you're like, I want to join this club and this club and this club. And then I'm just on an email list. I'm not doing anything in the clubs, and nobody cares that I'm in them on my medical school application. People care when you dive very deeply into something. So for example, when I was in college, I started my own club to try to show initiative for something that wasn't at the institution. I started a community crisis management club where people who were in the club became trained and became crisis hotline counselors and worked on a suicide hotline. And so that was a club that I got asked about in all my interviews because it showed initiative. I dove deeply into that one thing instead of just being a member of a lot of things and not really diving deeply. And that kind of goes into my next point of not limiting yourself based on what is available to you easily. You can, if you have the motivation, the creativity, and the drive, you can always start something on your own. Just like the example I mentioned, if you're interested in robotics or if you're interested in cooking, like for example, you can create your own club. Maybe you want to dive into the nutrition of patients with certain medical diseases and you create a club about that. Like you can be creative and align your passion with kind of like a path towards med school. The last section here is volunteering. So I recommend you get involved early and be consistent. This is kind of a similar thing to what I was saying before, where a few hours at multiple different unrelated venues is not meaningful. 50 hours at one venue is meaningful. So instead of volunteering for 2 hours here and 2 hours at this club and 2 hours at this summer camp, pick one thing, whether it's a food bank, a produce drive, a blood drive, it doesn't have to be in a hospital, a crisis hotline, and volunteer for 50 hours, 100 hours over years. And that is a meaningful experience compared to just doing multiple things in small quantities. Okay, and so if you do it over years, even if you're only volunteering for a short time, if you're consistent, you can let your hours accumulate. And so think outside the box. Like I said, it doesn't need to be this classic volunteering at a hospital. To be honest, I actually think that that's not even the most, I mean, I think it's good to volunteer at a hospital, but I don't actually think that it tells you anything about what it's like to be a doctor. Usually they use the volunteers to push a patient in a wheelchair or clean up an area. And so if you have a different volunteer experience, such as what I mentioned, like working as a suicide hotline phone responder, that is much more meaningful than being a hospital volunteer, since the admissions committees know what that entails. Being creative and finding something else that relates to medicine is going to stick out a lot more. And then I like to give this example, and it's phrased on the slide as if it's a random person, but actually it was me. I love writing. Like I said, I minored in creative writing. And so one extracurricular that I had was I really wanted to write for some type of medical blog. And so I found a small oncology blog and I sent them a cold email asking to be a volunteer writer, and they let me. And I was able to just write about oncologic topics in a blog for patients, not a peer-reviewed journal, just a blog. And I got asked about it in all of my interviews. So I think there are experiences like this that are out there if you search for them. And it doesn't have to fit the cookie cutter checklist. You can find unique things, and those are usually what people are going to ask about. All right, so in college, that last slide was meant to be more for like high school general advice. This now we're transitioning into college, since I know we have some college students here, and I'm sorry that we've kind of neglected you up to this point. I would say my biggest piece of advice in college is to be open-minded and curious, no matter what year you are. Your interests can and probably will change, and this is true even in medical school. I thought that when I was in all of your shoes, I thought I wanted to be a pediatric surgeon. And now I am an internal medicine adult doctor who does not do any procedures. So Clearly, I'm the complete opposite, and there was about 10 different decision changes that happened in between. And so just last month, I thought I was going to be a geriatrician. Now I've changed again. So things change over time. Don't feel stuck to something just because you've said you wanted to do it. It's better to have an open mind. And so you can major in anything. What matters is completing rigorous pre-med prerequisites like we talked about, challenging yourself. The examples that I like to share, English majors, I know art history majors who are in my program, engineers. I actually met a ballet major at my NYU medical school interview, which is one of the most competitive medical schools in the country. And so clearly she was able to get an interview with a very unique major, and that probably stuck out to them. So choose something you genuinely enjoy. That's that passion alignment and will excel in. And also consider a backup plan. What if you decide you don't want to do medicine? Or if you decide you want to change direction, will your major still help you get employed? That's an important question given all of the money that you or your parents or your student loans will reflect about your college experience. Extracurriculars in college, I think this is similar to before, so I'll be brief, but continue to grow your clinical exposure in some way, whether it's patient care, shadowing, global health trips are like a great thing to do. Med school committees love them. Show initiative, consider creating your own project or community impact, like I mentioned. Try to publish if you can and be creative. It does not need to be a peer-reviewed journal. I think that that's a lot of advice that the cookie cutter like advisors will give you, but I, to be honest, disagree. I have published in several peer-reviewed journals, but I've also published a lot of narrative medicine articles reflecting on patient experiences. I'm into medical journalism. I publish a lot in that space. And I got asked about it at all of my interviews. And so clearly it was standing out to people as something unique and valuable. It's a different skill set from publishing primary research in a peer-reviewed journal, and I think students should aspire to do both, but I think it still is something that can bring a unique flavor into your application if you're also publishing within the medical space in different avenues. And then I advise people to try to find unique programs or opportunities that allow you to stand out. Keep a pre-med journal with all your activities and reflection points after you go to an activity. Maybe take 10 minutes to reflect on any thoughts that you had, because years later, when you're trying to write tons of different essays for different medical school prompts, you're going to be wishing that you had put in a little bit of work earlier and thought like, well, what did I actually feel like after that experience? And so that can help you a lot down the road in brainstorming interview answers and writing essays. All right, so we're going to transition a little bit here. If you feel motivated from all of that and you're like, yes, I want to find my passion, I want to create a unique application, I want to stand out, that's obviously why I'm here, but you're not sure what to do next. I hear this a lot. I hear students say, how do I find a meaningful opportunity? How do I learn more about medicine? How do I connect with a mentor? And if that's you, I'd really like to show you for the next few minutes before our Q&A what I've built at Docera and why. So most pre-med students, like I had mentioned, spend years preparing for medical school before ever truly learning medicine. And Docera was created to change that. Our mission is to help future physicians engage with medicine through physician-led education. Primarily me, I am the teacher and the lecturer, and project-based learning. And so inside Docera, students learn directly from physicians. They explore real clinical topics, they build meaningful projects, and they develop experiences that help them stand out. Stage one in Docera, if you were to pursue this, is that you would learn medicine. The curriculum, students spend years before in med school learning things like chemistry, physics, biology. We don't teach that. Just Docera's curriculum is designed to expose students to medicine in a way that other classes do not. We talk about clinical specialties like cardiology, pulmonology, neurology, hematology. We dive into medical research and evidence-based medicine, genetics, immunology, medical ethics, public health. And the goal is really to build a deeper understanding of medicine while discovering the specialties and topics that genuinely interest you and perhaps help you discover your passion. So why does it matter? I think, like we said, most pre-med students follow the cookie cutter approach. They're studying biology, chemistry. They know very little about disease, clinical reasoning, how a physician thinks through a presenting symptom with a patient. And we're kind of the first and only program that are trying to bridge this gap, since these seem to be the qualities that matter, is being able to understand disease, clinical reasoning, and get exposure in this space. And so, that's kind of where we are. And I think prior students, which you can see on the bottom, the program has helped change the way they think about medicine and help them realize that being a physician involves a lot more than just diagnosing and treating illnesses. And they feel a lot more comfortable talking about medicine, what it's like, and it shows in interviews. So, just for one moment, if I can keep your attention, I'd like to drag you into our cardiac disease module just to give you a flavor of what it would be like to learn medicine in our program. We do case-based instruction. So these are all anonymized patient cases. For example, this one is a 64-year-old female. She has a history of hypertension and coronary artery disease, and she's coming in for shortness of breath. There's a lot more on the narrative, but I'm just going to be brief for time's sake. I have her chest x-ray up here and a picture of her legs showing pitting edema, which is just the word for the type of swelling she has. And then we would go into the reading room and we would learn how to read a chest x-ray. And you can clearly see the one on the left is normal. The one on the right is highly abnormal. It is consistent with fluid in the lungs. And then we would talk about the fact that this patient most likely has congestive heart failure. We would talk about the pathophysiology of that. What does it mean to have heart failure? And why does it happen? There are several more slides in here that I've cut out for brevity's sake. We would talk about the types of heart failure. We'd talk about the treatment of heart failure. How do you prevent heart failure, and so on. And then once you're finished learning medicine, you go into stage 2 of our program where you complete projects. This is your opportunity to showcase what you've learned. Students can choose from physician design project ideas and develop medical articles, clinical deep dives, infographics, educational presentations, patient education resources. We like to think that these are all projects that students wouldn't have been able to complete previously because they wouldn't have the knowledge base. Stage 1 of the program is meant to teach you medicine so that you're equipped to do projects like this that medical students usually complete. And then students receive physician feedback throughout the process. So you're matched with a physician mentor, and you kind of get asynchronous feedback in order to help you develop your interests, and help you hone your writing skills, your presenting skills. So you get feedback on your work. The goal is not simply to complete an assignment, it's really to build a portfolio that demonstrates your curiosity, your initiative, and a genuine engagement with medicine. Let's glimpse into the Project Hub just really quickly. So the Project Hub is where students on Docera can pick up projects to work on. There's around 150 projects at any given time that are open and ready for students to just click and enroll. So this is just a brief screenshot of some of the projects open right now. For example, the role of gut microbiota in GI disease and systemic health, Duchenne muscular dystrophy. You can write an article about that rare disease, or Down syndrome or rheumatoid arthritis presentation. These are all things that might seem overwhelming to you now, given that you've never gotten to learn medicine. But once you complete the program, learning portion, you'd be like, oh, I could read and write an article about rheumatoid arthritis because I'm familiar with what that is. So say you pick a project, maybe it's this one, how social determinants of health impact asthma outcomes. And then this is what you'd receive. So you get a description of how you should complete the project, what it entails. If this one's either 14 slides or a poster, and some options for you to disseminate it. So that's what I'll talk about next, but we partner with several magazines, health blogs, where you can publish your work. And we partner with, we have a large annual Emerging Physicians Conference. It is a physician-reviewed conference and a physician-judged conference where you can submit. So on each project listing, there's options of where you can try to disseminate your work and some guidance on how to complete it. If you don't find a project in our Project Hub that is in alignment with your passion, you can propose your own project. So stage 3 is sharing your work. Dissemination is what we call it in medicine, which just really means sharing with a broader audience what you've created. So, for publish, you can share your work with a broader audience via medical blogs, educational websites, patient education platforms, similar to the work I was doing, like I mentioned, when I was in your shoes, where I was writing for an oncology blog. And a lot of admission committees really valued that, and they thought it was really interesting, unique, and important, since one of the critical skills of a physician is being able to relay information clearly. This would show that you've honed that skill. Um, you can also present your work. You can submit your work for the Emerging Physicians Conference. As I mentioned, it's a national conference. It's fully virtual, so there's no cost to attend. It's physician reviewed, and you can present your work before doctors, other medical educators who attend, fellow future physicians in kind of a space like this, where you would work on developing your communication skills and your presentation skills. And then there is awards that are given to students based on excellent presentations. So a few students are selected to get awards. Um, Publication and presentation opportunities, I like to tell people, are not guaranteed. They're merit-based. So a common question I get is whether students are guaranteed to publish if they join the program. We don't guarantee that, because we want these opportunities to be prestigious and maintain prestigious value. And they wouldn't be if we allowed everyone who came in to publish, regardless of the quality of their work. So I would say motivated students who go back and forth with their physician mentor and are really trying hard to produce quality work and able to do so are able to access these opportunities, but it is not guaranteed and it is merit-based. So how can you get involved? You can join in a variety of ways. So I run a medical intensive in August, where from August 3rd to August 13th, you sit with me on Zoom in this setting, except a much smaller group, because it's interactive, it's discussion based, and we walk through all of the curriculum live. So you'll spend about like 10 or so hours with me on Zoom over 2 weeks learning the curriculum. Actually more, probably about 14 hours once you do the math. And then you can complete up to 3 medical projects in our project hub with physician guidance. And so it's a very small group interactive cohort. And for that reason, we limit the size of students who can join. There's only 8 seats remaining, but our July cohort has already filled, but there is still some seats for people if you're interested in this kind of like immersive experience. If you prefer to learn on your own schedule, we also have self-paced options available. So our Elevate program is and launch programs are the same curriculum that we teach live, just in a self-paced format. So you get access to pre-recorded lecture videos of me lecturing about the content, and you can watch them on your own time, and you can still complete projects. And that you can start as early as today. So you don't have to wait until August if you'd prefer to do it self-paced. And you can learn more on our website, which is docera.net. All right. Thank you all so much for your attention and for listening. I left like almost half the time for questions, since I usually get a lot of questions here. You can ask me anything. Let me send the link in the chat. You can ask me anything. It doesn't have to be about docera. It can be about medical school admissions. It can be about docera if you're interested. It can also be about life as a doctor, and etc. Okay. And then I will keep an eye on this form where you can enter your questions. You can enter the question anonymously, or if you'd like to put your email in case I don't get to your question, I will email you a response. I do see that someone asked in the chat, if it costs money, how can we know that medical schools will see this with an objective perspective and know we are qualified and not think we paid to enter? That's an excellent question. I think that really what you're paying for in this program is the opportunity to learn from a physician in real time on Zoom, similar to how you pay tuition to go to college to get to learn from professors. Publication and presentation is not guaranteed. And so if since it's not guaranteed, it is merit-based, and we feel like that allows people to see value when students are selected for those opportunities. Okay. And so now I'm going to switch over. So if you have any other questions, enter them into the form just so that I see them, since that's where I'm looking now rather than the chat. Okay. I have a few questions in here. Um, Is there a way to participate in this program for free? Unfortunately, not currently. There's not a way to participate in it for free. Yeah, we don't actually offer scholarships, and I'm sorry about that. I hope to at some point, but we just don't have the capacity to. Are the publication, what are the best strategies for memorizing and understanding medical terms and information long term? That's an interesting question. I think that medical students use this program called Anki, which you can probably use in college if you wanted to. It's just a free database, it's like a flashcard website that does spaced retention and it helps people. I remember I had like 40,000 flashcards on my Anki app in medical school. And so um, having spaced retention helps you because if you get the question right, it would only ask you again in a week rather than every day. That's how students accomplish it. Is there a certain requirement to enroll in docera? No, there is not. Anyone can enroll as long as you are in high school or college, or if you're a non-traditional student, you can also enroll. Um, is competing in HOSA or scientific Olympiad competitions in high school worth it? Um, that's a good question. I think it is. I think if you have something you're passionate about and you're competing in those projects, I think that and or you're competing in those competitions, I think that just shows that you're dedicated to your project, and I think that could be worth it. I think maybe diversifying some of the things you're doing is also good. Okay. Um, Is it harder for DOs to get residency than MDs? That's a good question. It depends on the type of residency, to be honest. I think some of the more competitive residencies, like dermatology, orthopedics, certain surgical specialties, it can be a little bit more difficult, if I'm being honest. But I don't actually know the data, so I'd have to look up the data for you. I guess my hunch is that I see a lot less DOs in those specialties. Okay. Um, How would an admissions committee view this type of program? That's a great question. I think that they would view it favorably. You will be able to talk in an interview about medicine in a way that other pre-meds will not because you will have spent several weeks learning the nitty-gritty of medicine. You'll learn how to think like a doctor. You'll learn how to take a history of presenting illness, meaning like ask a patient all these questions about their chief complaint or the symptom they're presenting with, and to try to get to the bottom of what their diagnosis is. You'll learn how to do that, especially in the live class. We do it in an interactive way. Which is a cool skill to be able to talk about. You'll learn diseases that other people have had no access to yet. So you'll sound educated in interviews. You can reflect on your experiences. Maybe you discover a passion that you never knew you'd have. For example, maybe you determine you're really passionate about glioblastoma, which is a type of brain cancer, now that you've learned about it and the impact it has on patients. And maybe you want to write articles about that and patient education articles. And that just, like I said, that's a passion. And if you pull it through your application, maybe you do real peer-reviewed research in that topic at your institution, and then you also do medical journalism writing about it. That just shows more dedication to something and will absolutely be viewed favorably. Okay. Um, what is Can I start docera over the summer and submit projects over the summer? Yes, you can. If you do a self-paced option like Elevate or Launch, you can start as soon as tonight. And I should have mentioned the QR code on the slide will kind of bring you right to the page where you can pick a program, and you can also browse our website. There's so much resources on it. The medical intensive program starts in August, so that's when you'd be starting. But the access to the project hub that I showed you never expires. So if you start in August and then you decide in several months you want to start projects, you can. Doesn't have to be right away. Um, okay. Is there any way to still get in if there's 8 seats left? Yes, you can still enroll tonight, for example, or anytime until the seats are filled. So once the seats fill, the listing will be removed from the website. As long as it's still up, the seats are open. And so there is a lot of people in our webinar tonight, and I think we had like 600 people RSVP. And so it's possible that it fills. So if you're interested, I would enroll on the sooner side, but there is still 8 seats. So you have time to get into the program. Do I have a live cohort in the fall and spring? I've not decided yet. I've run a few cohorts over the summer. I might run a fall cohort, and if I do, I will send an email out notifying you. If you are on our Future Physician newsletter, you'd get that email. If you're not and you would like to be, you can head to our website and sign up for our newsletter. When you go on our website, you'll get a pop-up saying, do you want to sign up for Dr. Kane's newsletter? And this is kind of a plug to sign up since I send a lot of cool opportunities in there, not just related to docera, and a lot of like clinical pearls and what's happening in medicine and stuff. So that's a free way to kind of like stay engaged. Um, all right. Thank you guys so much. I have like 60 questions, so I'm trying to work through them. And if you put your email in, I'll try to get back to you with a response. Is there scholarship opportunities? If not, are we able to apply later on? Um, you can apply later on for the self-paced programs. There are unfortunately no scholarship opportunities at this point. But in September, October, this person's interested in joining, you can enroll through our self-paced options like Elevate or Launch. Or if we have another live session, I would let you know if you're on our newsletter. Okay, let's see. Can the presentation be used as a research project for college applications? Absolutely. You're going to be presenting, you're going to be submitting your project for a physician reviewed conference. And if you get accepted, that is a prestigious feat. And then you will be able to present in front of physicians and may even win awards, for example. And so that's absolutely something that you should put on your college application as a research experience. And one person asked, could our advisor in the program be specialty specific, like a surgeon? And that's absolutely true. Yes, you can request a certain subspecialty of medicine for your advisor.
Wait, I apologize. I'm not able to access the form, but I had a quick question. It was about the research. Like, what kind of journals do we usually publish in?
Yeah, that's a good question. Let me go back in my slides. We don't do peer-reviewed research. This is not primary research. This is medical communication projects, case presentations, and we publish through patient education platforms, medical blogs, education websites for patients like the ones shown here. So the Medical Literacy Initiative is one of our big ones. Some of our students have found a passion in our program of health literacy, and they write articles, for example. One that we recently published was about a new treatment for prostate cancer. And so the student did a lot of research on this new treatment that's coming out for prostate cancer and wrote an article with the audience being patients to educate people about this new treatment out there and to ask your doctor about it and to increase health literacy around that topic. And that student was able to get their work published in the Medical Literacy Initiative magazine. So those are the places that we publish work. And then we do presentations at the Emerging Physician Conference, or if students find a different conference they want to submit to, they can. Okay. If I want to do a project for docera, do I have to complete step 1, which is the learning, in order to do it? And how long does it take? That's a great question. So docera is very flexible. There's 10 modules that you learn through, and the full curriculum's on our website. But what's great about it is that once you complete one module and you take the quiz for that module and you pass it, you can access the project opportunities for that domain. So for example, cardiology is our 3rd module. You'd probably complete it about like 2 weeks in. You would probably get to module 3. And then if you complete the cardiology module, you could then work on a cardiology project before you finish the rest of the curriculum. So it allows you to start working on things earlier. I hope that answers your question. But yes, you do have to take I'll show you on the slides here, you do have to take the required module and pass the quiz before you can pick up a project in that domain to show that you've mastered the subject. So, for example, this project listing on the page here shows the social determinants of health and asthma, and it says at the bottom here, like requirements is the introduction to medicine module. Okay, let's see what else. How many specializations should I shadow and how many hours are best? That's a good question. I think one that a lot of people will have. I think it's more important to pick something that you like and shadow it for a longer period of time, potentially with the same physician if you can. Shadowing is important because it can help you develop a relationship with a physician. I've had a lot of students reach out to me this summer, especially high school students, because they're too young to shadow, but they still want to get experience. And that can be difficult. I would say reaching out to primary care practices, seeing if you can get involved, trying to stick with one physician so that you develop a relationship and that they get to know you and can write you a letter of recommendation in the future. The other thing is just thinking outside the box, right? Like, I do think everyone should shadow, don't get me wrong, but for example, in our medical intensive program, I would say that you're learning a lot more medicine through our program than you would be from shadowing. I remember as a pre-med going to shadow and kind of like zoning out throughout the day and maybe just worrying about how I was being perceived and trying to be polite and never be in the way. And it wasn't really me learning medicine and enjoying my experience. And so that might be unique to me, although I think a lot of my friends can relate who are in medicine. And so this is a different way to get exposure to medicine. I don't think it's a replacement, but it's definitely an adjunct. Okay. All right. Let's see. Okay. Um, Would your application look the same if you want to apply into a BSMD program? And there's a few other questions in here like, what would you recommend for BSMD programs? Is it worth going into? I think it absolutely is worth going into if you know you want to do medicine. I think if you're on the fence, it doesn't have to be docera, but trying to do some program where you're really learning what medicine is like would be a good move before you commit yourself to a BSMD program. Like you really have to know for certain. But if you do know for certain, it is a huge advantage and will save you so much stress. And if I could go back in time, I wish I did that. I just wasn't confident enough as a high schooler to know that I wanted to do a BSMD. So if you are, then it's an excellent opportunity. It will save you a lot of headaches in the future. And I would recommend it. But if you are not, for sure, I would recommend trying to get more experiences to become more sure through things like docera or other opportunities if you've found any in your community. Okay. Would you have, oh, here we go. Sorry. I already read that question. All right. Do you think it's smarter to major in psychology or choose a non-science major? How much does your undergraduate major actually matter? I think I touched on this earlier. I think that you should major in whatever you're passionate about and whatever makes you happy because you'll be able to light up and talk about that and why you wanted to pursue that. And sometimes unique majors stand out. I think you should still, though, pursue very rigorous pre-med prerequisite classes and you need to excel in them. So it doesn't mean that your course in college will be easier if you choose a major like psychiatry or art history or English. It just means that it's something you're passionate about, and that's excellent. But just make sure that your other classes are really rigorous to try to show that you can kind of excel in a rigorous place. Is there another way to get the slides? Yes, I can send the slides after the webinar. Tonight you'll get a thank you email with a few more details, but tomorrow I'll send the slides. Okay. Um, Okay. Would a phlebotomy certification be helpful for clinicals? Um, I think so. I think that it's one thing that you could do to try to kind of like get your foot in the door at a hospital. I think that it's not a full solution since phlebotomists really don't, their job is so different from physicians, right? Like they're not really talking to, I mean, you can talk to patients, I guess, as a phlebotomist, especially if you're working inpatient, but your work's really fast. You go in, you stick a needle, and then you leave. And so it's really different than being a physician and learning to think like a doctor. And so if you are doing that, I think that's fine. But I would try to like also diversify your patient experiences elsewhere. Okay. Let's see. What uh, what does the docera curriculum entail? I think we went through some of the curriculum slides on here, but we learn things like heart failure. We in our cardiology unit, in our pulmonology unit, we learn like what is oh,
I
we
can't.
learn. Hello, I think someone is
Oops,
unmuted.
sorry.
That's okay. Um, yeah, so I think we learn in our pulmonology module, for example, we learn like what is COPD, how do patients um, how do patients kind of like quit smoking? Why is smoking bad for you? We learn what is cystic fibrosis. We learn about medical ethics, patient autonomy, so many things. How do vaccines work? What is an autoimmune disease? What is lupus? All of these things we learn. You'll learn over 100 diseases. And it says, is it useful for um, Is it useful for a 10th grade student who wants to go into medical school? Yes. This program, I should have mentioned, the ages that it's useful for is ages, grades, like high schoolers, and then also pre-med students in college. Because it's information taught in medical school and it's simplified in a way that you can understand. Anyone who's interested in medicine kind of excels at this program. You don't have to have prerequisites. We do have some videos for people who haven't taken genetics, for example, to try to catch them up to speed. But yeah, it's could be for high schoolers or college students in their undergrad, right? Would it be useful for a 10th grade student who wants to go the medical path? Yes, absolutely. It's a great question. Um, okay. Yeah, a lot of people are asking if they could be a if I could be a mentor to them in the future, and that's really sweet. Um, I mentor, like I get pretty close with the students who do the intensive program since we spend a lot of time on Zoom in a small group setting, and get to know them and their goals. And then I actually take those students kind of under my wing and mentor them for the projects that they complete. If they want to, they're also completely allowed to ask for other physician mentors in the specialties that they're interested in. But outside of docera, I do some mentoring, and if you're interested in that, you can contact me either through docera. Um, I'll send the email in the chat. Oops, and we can set up a time for mentorship. Okay. Can I? What is this saying? All right. I know there's only like a few minutes left, and I know attendance is dwindling. I'm sorry for keeping you. There's a few more questions that I'll address in the next 4 minutes, and then we'll wrap up here. Um, is there a limit to how many people can work on the projects? No, actually, that's a good question. So once you sign up for a project, it kind of goes off the market. So it will prevent other students from choosing the same project. But one unique thing about docera is if you enroll with a friend, first of all, you get a discount, which is on our website. You get $100 off each, but also you can do projects with them. So we have some people who recently published and they are co-authors on their papers together. If you don't have any friends that are going to join, you can also indicate when you pick up a project. You can say on the project submission form that you want to work with someone else, and then we can pair you with another pre-med student. It's a great way to meet somebody who's also pre-med and a good opportunity for you to kind of like work together in a team. So you don't have to do everything independently. Okay. Um, all right. What is medical school like? I love this question. Medical school is a very unique experience that is unlike anything else, in my opinion. Medical school is divided up into a learning phase and then a clinical phase. So the first 2 years of medical school at my institution where I went at UConn was very dense learning. I was studying 10 to 14 hours a day. I'm not exaggerating. On the weekends, I would sit at my desk from 8 a.m. to 10 p.m. and I would study and I would only get up to eat and go to the gym for an hour. And while I was at the gym, I was doing flashcards. So it is a very intense experience and you really have to love medicine. Um, that was also part of the motivation for this program. I'm someone who loves learning. So when I was in your shoes, I would have been like so excited if a program like this was available for me to start learning medicine because I just love medicine and I wanted to like learn it, but I didn't have any way to. There was no programs like this. Um, and so I think that's what the first 2 years were like. The next 2 years, you jump into clinical rotation. So you spend your day in the hospital or in an outpatient clinic, depending on your rotation. You go through different rotations and learn different specialties. So in the internal medicine rotation, you're working on the wards at the hospital, taking care of patients, working directly with the residents. So I teach a lot of students now. The Harvard med students I usually mentor just because they work on my team as a resident. And then you also get to do cool experiences. Like I got to deliver babies on my OBGYN rotation and observe different surgeries on my surgery rotation, et cetera. So you get to experience everything in medicine during those clinical years. And that's where you really determine, like, oh, I thought I liked surgery. Turns out I really do. Or maybe I don't, based on how the rotation goes. And that's during that time you're still studying. You have exams after every rotation. So you spend 6 weeks in surgery, then you have a national surgery exam. And then you, at the end of your third year, decide what you want to apply into for a specialty for residency. And then you submit an application all over again, just like med school applications, except a little bit less stressful, where you're applying into residency, which is where you get your subspecialty training. But that's a great question. Can Docera be added to applications? Yes, absolutely. It's something that we can help you with how you should describe it because it's something that could have a lot of value if you talk about it in the right way. Okay. How long are the 2 week live programs per day? It's an hour and a half per night. So, and from August 3rd to August 13th, we meet Monday to Thursday from 7 to 8:30 p.m. Eastern. How does the self-paced differ from the live course? Are we still guided by physicians? Yes, you are still guided by physicians. During the curriculum part, it's different in that you're sitting at home on your own time when it's convenient for you, watching lecture videos of the curriculum. That's different from the live class, which is like a set time, 7 to 8:30, where you're sitting with me and I'm teaching you the curriculum live in an interactive way rather than watching a video at home. So you're interacting with the physicians a lot less in the self-paced programs because you're just doing them from home on your own time. But you still, when you pick up a project, you'll still get that physician guidance through the project. It's the same in that sense. How many times a year is the live cohort offered, and what is the student to physician ratio in the class? That's a great question. So our July cohort I can speak to since it's already full. The physician ratio is 15 students to one physician, which is me. And it's offered in the summer. Right now, we have not decided to open a fall or spring cohort yet. So August is kind of like the last chance for this year. But if that changes and we decide to open a fall cohort, I can send an email to our future physician newsletter. If you're not on it, I recommend joining it. It can be a good place to get opportunities, not just in Docera, but across medicine. Okay.
Make sure I don't activate this.
Sorry, I think I missed that if someone was meaning to talk or maybe just accidentally came off mute, which is okay. All right. Oh, someone said this.
Hi,
Oh, hello.
Mallory. Sorry, just a quick one.
Okay.
Can someone still register for August cohorts?
Sorry, I don't think I caught that. There's a little echo.
Can someone still register for August cohorts?
Yes, you can still register for the August cohort. The registration is open. There is, when I started this webinar, I haven't checked to see if anyone's bought in it yet, but there is 8 seats. So once the seats fill, it will be taken off our website. But right now, there's still 8 spots open for people, and you can register on our website if you scan this QR code, and then you scroll down to the intensive program. That's the live program in August. And so just by enrolling on our website, by purchasing the intensive program, you would secure yourself a seat. Okay. Um, Thank you guys so much. It's 3 minutes over. I really want to respect your time. Nobody likes being stuck late in meetings. And so, yes. Oh, so one last thing. Somebody asked, if you work with a partner, do you get 100 off the live package too? Yes, you do. So in order to do a friend enrollment, you basically both sign up for the program and then you send an email to docera, info@docera.net. The instructions are on the website, and say, I joined with this person. We're partners or friends. And then we reimburse you the $100 each as a refund. And you can still register for August. I hope to see you guys there. Someone asked, do we pay separately for each project? No, you do not. Everything's included in the first price that's upfront. And I think that's it. I think those are all the questions that I'll answer. Thank you guys so much for coming. I hope that you learned something today. Yeah, and I will send the slides to you all for your review in the future. All right. Bye, everyone.
Bye. Thank you so much for explaining all this to us.
Of
Bye.
course.
Thank
Bye,
you.
everyone.
Okay, bye.
Bye, thank you.
Bye.
Thank you.
Bye, everyone.